Hi. So about the Alaris pump here, in this section we'll talk about hanging a primary infusion. So with the primary infusion, you want to check the doctor's order to find out which primary bag that you want to run. In this case, we're going to assume that the order mentioned using normal saline or 0.9% sodium chloride. This in conjunction with the pump means that I have to have a way to hang the bag up here and have tubing that will run through the pump. Now, many times the tubing itself is specific to the branding of the pump. In this case, this is the Alaris pump, so I would need Alaris tubing. Now, one thing to remember here is that on every tubing, on the top corner there is a drop looking symbol here. And the drop symbol here in this number right here, you can see the number 20. And that means that if you were to run this, say the pump breaks for whatever reason, there's some kind of disaster and there's no more power, there is an internal battery inside the pump here which would list the amount of battery life it is in bars. Now say it ran out or there's a malfunction, there's nothing else available, we can convert this into a gravity setup. So this number will tell you how many drops per milliliter it would be. So when you do your calculation, you would run the calculation using 20 drops per milliliter. In this case, you're going to take your package, in this case is the IV, the primary IV, inspect the package, make sure that it's not expired, that there's no rips or tears in it. I will then open the package up, remove the actual infusion bag, and inspect it for any tears. There are times when you open up the bags and inside you'll find a tear or a rip or a leak. It is common though that sometimes when you sterilize these with the gas sterilizer that there may be some condensation, and that's normal. So how you can tell is you can just kind of check the pliability of the bag here to see if there's any active drainage or active leaks. If it is, you would discard this and get a new one. In some hospitals, they want you to label the bag with the patient's information on it, which will pretend or simulate that it is now labeled. On the bottom, you have two ports here. This port on the right side, toward your right, is where you would twist off to actually access the IV bag. The other port here, if you can tell at the bottom here, there is a small plastic surrounding a softer area that can be swabbed with alcohol for 15 seconds and then accessed with a needle device. In this case, some have lower locks, and you'll be able to add medication if applicable. So in this case, we're not going to use the port, we're only going to use this port right here. So switching to the name, it's normal saline, 0.9%. Remember that is normal saline. And the amount on the bag. Sometimes there will be expiration dates. In this case, this is practice. Expiration date of October 2022. Okay, so that is good. I'll put this down and open up the tubing. I remember that's 20 drops per milliliter. You will then open up the tubing. When opening the tubing, it's very important to remember though that you should always have control over the tubing itself, especially the ends. If it touches the ground, then I will consider it contaminated if it gets dirty. Now there are tape holding it on. You can just basically tear off the tape itself and discard these into a trash receptacle. And once again, I'm controlling the ends. Here is the end right here that's called the drop chamber. This right here. So when this is on the inside the bag here, let me see, make it look easier here. Like this, when I access this, this is a cap that has to be removed. This is the cap that has to be removed. When I insert this into here, you can imagine that drops, you can visualize through this chamber here. So if I use a gravity setup without the pump, that's where the 20 drops per milliliter come into handy. Now you'll also notice then that there's also a port here that opens up right here. This is called a vent. And why that's used is because most of the time we hang an IV bag, it's in a nice soft pliable bag. So when the fluid leaves, the bag collapses. So consider if you have a medication that reacts to the plastic or whatever it is, it will be supplied in a glass bottle. So you may have seen those already. When the glass bottle is attached to the top of here, there's no way for the container to decrease or when the fluid runs out. So it'll create like a vacuum. So you must open this port when you have the glass bottles to allow for air bubbles to escape. Okay, and I'm going to go ahead, I'm going to control this end here while I am checking the tubing here. I'm just basically going through my hand. Here is the white one-way valve I mentioned earlier. Right below that is a Y site. This is the part that I showed in the previous video that went inside the machine, which we'll take out later on. And there's a blue sheath here that holds the flexible tubing, which can be discarded, leaving you with this right here. Remember, it's flexible, okay? If I follow it down, I will then run into the roller clamp. And if you wanted to, you could always put the clamp down. See, if I move my hand on the clamp here, I can't move it. I can't move it up, and I can't move it down. If I roll the clamp upwards, you'll notice then that I could move the clamp up and down. That's how you know if it's open or closed, all right? I'm going to follow it down further. Remember, I'm controlling the ends at all time to make sure I don't contaminate my supply. There's no kinks, there's no abrasions, and there's another Y site here at the bottom right here. So I have two sites, two Y sites on this tubing, and why is that? Well, the closest Y site to the patient is where you'd be giving your IV pushes. The Y site closer to the pump side is where you would hang the secondary pumps, which I'll show you in an upcoming video. So in this case now, I am going to go ahead and apply the roller clamp itself. Then I'm controlling all the ends again. I'll take the bag here that I'm going to be using. I'm going to twist off the cap here. Okay. Being careful not to touch the inside of the connector right here because that would contaminate it. Remove the cap off my drip chamber. Okay, it is sharp, so be careful not to hurt yourself. Now, when you're ready, you want to control the ends of the tubing. You're going to introduce this spike into the bag without trying to go through the sides. You want to go in straight. And you can imagine that if you didn't go in straight, you went in crooked, it is possible for this to poke through the sides of this bagger here and you can potentially harm yourself. Now, how far do I go down here? I'm going to keep twisting in a back and forth motion until I try to reach the collar here and go down as far as I can. Okay. Okay, in that case right here, you can see how I have it inverted here with the drip chamber, and I have it up to the collar there. Okay. Now, because I've put the roller clamp on, it's not going to do anything and start to drip because it's a sealed system right now. So with this, I'm going to hang this up onto the IV pole. It is the only thing I'm hanging right now, so it'll be up to the highest point. Okay, and then here's the drip chamber that's currently empty. Give it a couple squeezes because you want the fluid to be about the 1/3 to half mark, somewhere in that category. So I'm squeezing it. You see the fluid coming out there? Okay, that's about halfway. Okay. Now all this is air in the line, which we don't want to run into the patient. So what I'm going to do here is I am going to what we call prime the tubing. I'm going to grab this, I'm going to pretend it's a trash can. Okay. I'm going to be careful not to, I'll use a graduated cylinder here. I'm not going to touch this end against the end of the trash can because it'll contaminate it. Even with the cap on, I always want to simulate that I want to keep the equipment as clean as possible. And you can imagine that you don't want the patient, their family, their friends to see you using something that looks like it's really important and you touch objects that are contaminated or dirty. Okay, in this case, I have the fluid here. What I'm going to do here is I'm going to use a roller clamp again. I'm going to open up slowly while holding this over somewhere where I can get the rest of the excess fluid from. And you'll notice though that when I open this up, from here you're going to see the bubbles move. Okay, so I'm going to open up slowly. See, the bubbles are moving. It's going down the site. I can stop it at any time by doing the roller clamp. Okay, one thing is that when I get to the Y sites, there's also air that could be in the Y site here, not just the tubing itself. So I want to get all the air out. So when this gets to the Y site, you're going to see me flicking it to remove the air out the side here. Okay, so I'm going to hold it this way. See, there's the bubbles moving right there. Okay, when it gets to the Y site, I'm gonna change hands. Sorry, and it's gonna be a little bit. Here comes the fluid. Okay, I'm gonna flick the Y sites now. Okay, so I'm gonna hold it here for you to see it. See the air, the air here. There it goes. Okay, I'm always gonna follow the last bubble though. It's like playing the guitar. Okay, I'm going to do this for just demo purposes. I'm going to I'm moving the fluid. Okay, following the Y sites. See, there's air right there, right here, near my hand right here. See, I'm following that. And it's not a race. You'll find that if people rush, they actually create more bubbles. So look how slow it's going right here. And I'm just going to stand here and make sure that I get to the next Y site here, this one right here at the end, so I can flick the bubble out, okay? See, it's not even there yet. So I'm waiting. It's right here. I'm going to speed up a little bit here. See, there it goes. And that's how fast you don't have to go really fast to get this done. See, I'm going to get closer here. When I get to the Y site, I'm going to start flicking it. There you go. No bubbles. Get my thing ready here, and it's going to, the air bubbles is right there near the tip. Hold it over a trash can. That's about 5 drops, 6 drops, 7 drops. That's all I've wasted, about 7 drops. It's hardly anything. Now, just like in the earlier video, I'm going to match up the blue to the blue here. And I'm going to push the blue end in first, okay? There's no kinks here, it's straight through. Here you have the flexible tubing. I'm going to raise it up and drop it in the top. Then I can close the door by lifting it up here, making it flat here, and then I'm just going to press the bottom in, and that locks into place. At this time, I can now open the roller clamp because this is what's me controlling the amount of fluid. So I'm going to pretend that this is the patient's arm, okay, that it's simulated off to the side here. Now I'm going to turn the pump on. For a few seconds, I wait for it to go through its self-test. I know that no more saline's been ordered for the patient. It's going to be a primary IV line that should be going about, let's say, about 25 mils an hour, okay? Let's say, is it a new patient? I'll say no, it's not a new patient. Are they medical surgical? Yes, they are, and that's the floor that we're on. Now we've got the A. It's not blinking, so I can't do anything, so I must hit channel select. I press channel select. In this case, I'm going to do the IV fluid. It's an IV fluid, not a drug, an IV fluid. I press that button, and I want to look for normal saline, okay? So here I have normal saline. Actually, it's right there in the front, 0.9% NS. Okay, once you find that, you press a little popsicle stick right next to it to identify it. It asks you again. See, these pumps are pretty smart. They're not as smart as us nurses, but they try to give us some kind of, of a focus on here. Was normal saline selected? Is this correct? Yes, it was. Okay, now on my primary infusion. The orders say to run 25 mLs over the next 8 hours, okay? So for rate, it's not colored in, so I must press the little popsicle stick next to it, the little blue thing. It turns dark, and my rate will be 25 mils an hour. Hit enter. Volume to be infused. This is a brand new bag. I know it has 500 milliliters in it, so I can now input, when I press the button it highlights, 500 milliliters. Okay, I can hit enter on that, and then it'll say press start. Ensure that all your clamps are open, and then you press start. You wait for the light to turn green, and the label will scroll here that verifies what you have hung. Now, if it's a basic infusion, you don't need a label on here. Then basically you would input the rate and volume to be infused. It would still run, but it would not have a scrolling name of what's actually hanging. Okay, so that's it. It stays green. You want to wait about a minute or so. Maybe you're doing your hand hygiene, maybe you're talking to the patient. It's kind of one of those things that if you walk away from it, it might start beeping. So ensure that the pump is running. There's no yellow or no red, there's no bumps, there's no kinks on the way to the patient. And then you can go ahead and chart on your intake that you started the new bag. All right? Thank you very much.